Welcome back to Better Together as One. You know, here at this show that we love to bring the evidence. And what better way to do that than to bring on a doctor who is not only an anesthesiologist, but also trained in medical cannabis. We are very honored and excited to have Dr. Amy Thiele with us. Welcome, Dr. Amy.
Hi, thank you. It's a pleasure to be here.
Well, we know how busy you are, and we're really honored to have you on the show. I'd love for you to explain to us, how do you go from being an anesthesiologist to medical cannabis, and how did you get there?
Oh, well, that's a good question. It's a good story because most anesthesiologists, as part of our training, we are trained in interventional pain management. And we do at least 2 months of that in our residency. And in my residency, I always enjoyed managing pain, but I learned early on that some of the interventions that we've taught to do, such as sticking needles in people, freezing body parts, epidural steroids, even some more interventional things like CT guided or ultrasound guided facet injections, all come with risk. Every time you stick a needle in someone, there's a risk of bleeding or infection. And I found that a lot of patients would only get not permanent relief. They might get, a week or two, maybe a month or two. And if you were lucky, maybe 6 months to a year. But ultimately, they would come back for recurrent blocks, as we call them, nerve blocks. Then, in the meantime, as part of the culture back then, was we were expected to prescribe pretty heavy medications, including opioids. So as people know, we are in an opioid crisis. Some of that has stemmed back from decades before with trying to manage chronic pain, especially in the non-cancer type situations. So in addition to just so many strong medications, so I actually decided not to do that kind of aspect of anesthesia. I kind of, went into the operating room and hid there for many years. But then by fluke, probably about 3-4 years ago, I started to hear and see patients either coming for surgeries who were disclosing they were taking medical cannabis. And I was, like a lot of physicians, very skeptical until I learned what medical cannabis was. And I found out that it wasn't, there to get people high. It was actually, there was other alternatives. They weren't just out smoking joints, and just kind of using it recreationally instead of, saying they were self-medicating. They were using it recreationally. I just thought it's just, whatever. But anyway, I started to do a little research, and the more I researched, the more fascinated I became. So then I started shadowing a local cannabis clinic in Barrie. That's where I live. And the first patient that I saw in that clinic was 90 years old.
Wow.
And after decades for that patient of having chronic pain, she wasn't able to take anti-inflammatories, wasn't able to take even Tylenol. She couldn't tolerate most medications. She was taking an extract of cannabis called CBD and was having amazing results. And she was back to almost independent activities of daily living. So it was a big improvement in her quality of life. So then I started doing it. And, a few years later, I love what I do. And so I just find it just so satisfying to be able to offer that to patients versus these terrible drugs. I mean, some of these drugs do work, but for the long term, a lot of patients are looking for alternatives. You can't take anti-inflammatories forever. If you do, you can run into problems with stomach and kidney issues. So having these alternatives has been wonderful. And actually, in terms of gratification, I feel privileged to be able to help patients in this way. So that's why I'm doing this.
I just love the way you describe that and really put everyone at ease with the knowledge. One of the things I'd really love for you to shed a little bit of light on is the delivery method, because I know there are many ways that medical cannabis can be used. Can you give us a little bit of background on what people can expect when coming to see somebody like you?
Yeah, absolutely. So whether someone's brand new to cannabis or they've been seasoned users, I still prefer to give people an internal form. So they either take it as a capsule, oil, or spray. The advantage of that is that it kind of keeps the background level of cannabis molecules stable in their body. Inhaled cannabis is always an option, and the ideal way for that is using dry herb vaping. There's bed vaping out there. Dry herb vaping is more acceptable. In fact, it reduces contaminants by over 90%. But if we can avoid the inhaled method of cannabis altogether and have people get a clinical result with orals, or the oils, sprays, and capsules, people actually do better. And even some cannabis users who tend to, be self-medicating, been reliant on it, and they tend to smoke every 2 to 3 hours, because I tell them their levels of therapy is like a zigzag. They're up and down, up and down, up and down with inhaled, because it kicks in quick, but it wears off quick. Whereas when you have an internal form on board, you have more of a smooth effect, so slow onset, but it also lasts longer. So that's because when you take things orally and it's absorbed through your intestinal tract, it goes through the liver, and then the liver releases the metabolites a lot more slowly. Whereas when you take inhaled cannabis, it's almost like giving anesthesia gas. It's absorbed through the vascular beds of the lung, and then it goes to the brain, and it has this effect on the brain, and then it dissipates much more quickly. But here with the base layer of cannabinoids in the system, it's a lot smoother, and then people need much less inhaled cannabis. In fact, you can get a lot of patients away from inhaled cannabis altogether.
Fantastic.
Well said. That in itself is a massive education for sure. And so now, us being in such a tricky time too, I from what I understand, I do believe you're seeing quite a bit of patients that are actually struggling with anxieties. Just sort of speak really briefly to that, if you could.
Yeah, absolutely. So I get a lot of referrals for pain management, of course, but I'd say that the next most common referral reason is for anxiety, plus or minus PTSD, and anxiety is a spectrum. And actually, there was a webinar last week I attended with other cannabis physicians across Canada, and it was hosted by a psychiatrist. And there's a lot more evidence. We're still waiting for the randomized controlled trials to come out on this subject, but there's a lot more evidence on the role of the endocannabinoid system in the neurobiology of anxiety. So some of the traditional pharmaceuticals kind of numb the feeling of that stress, anxiety, panic, whereas the cannabinoid receptor activation actually helps the spinning top, as the psychiatrist said, the spinning top that's in the brain, that flight or fright part of the brain that contributes to anxiety. The cannabinoid aspect of that helps the spinning top slow down, versus just throwing pharmaceuticals on it, which kind of numbs people to feeling the spinning top altogether. So it's actually a more holistic kind of approach to anxiety. And from my experience, even though I haven't seen the randomized controlled trials, patients do well with fairly high dose of CBD in their system to help with those symptoms. They don't even need THC a lot of the times.
Oh my goodness, we're going to have you back, because we're just blown away by your knowledge, and I can't wait to learn more from you. Before we finish off, I think it's really important. What I love about the show that we're doing here today is that Jennifer was on as an educator alongside you, Dr. Amy. Tell us why it's so important, and the value in working with a clinic like yours, where the two of you are working together to help a patient and create a treatment plan that's going to be effective for them.
Yeah, absolutely. So I think everybody has something to learn, and a lot of people, cannabis is everywhere, whether it's black market, gray market, people are growing things in their backyard. I think some people are still at a loss for how to take it, what is the optimal dosing. So when I explain the rationale, first off, I understand as best as I can what's going on with their own physiology, what's going on in their lives. I do a thorough medical assessment. And then, so I give them rationale and a little bit of education on how cannabis is going to work for them. I find that kind of primes them for a bit of hope, because a lot of patients have been through, especially in the pain world, a lot of people have been through so much. They've been through everything. They've been through pharmacologic treatments, non-pharmacologic. So it's a first bit of hope that they've heard in a while. And then when they actually hear that people are doing well with this, I also give the proviso that it doesn't work for everybody, but a high chance of success. So that sets people up. So then when they're ready, and then Jennifer does her magic, and we go through the register, they have a lot more confidence and buy-in and even compliance So it really is a good partnership in synergy. So I sort of do the preliminary educating, base bit of information. And then when Jennifer starts to make her recommendations of this strain or this product with all the different companies that are out there, people are like, oh yeah, this sounds good. So they're even ready. So it definitely is a great partnership to have. And then the feedback we get from patients is that no one ever spent time with me like that, or no one explained it, or no one gave me, rather than just like be thrown a prescription and, here you go. It really, I think education is key. And I agree with your own philosophy. I think supporting patients, empowering them, then they take a little bit of their own victim mindset, and then they could actually start on a different kind of mindset of their healing journey.
Well, thank you so much. I couldn't agree with you more. We are better together as one, and the patient in the center to empower them is critical. I want to thank both you, Jennifer, as well as Dr. Amy, for coming on and really helping to demystify there's so much out there that we don't understand. And I hope that you'll both come back and continue to do some segments with us, as we truly believe in educating and empowering everyone that's listening and watching our show. Thanks for joining us.
I agree. Thank you.
Thank you.
So on behalf of the entire Better Together as One team, we want to thank you for joining us. Make sure you follow us on all the social channels, and of course here on your TV. And from all of us here at Better Together as One, until next time, be well.